So imagine this. The doctor tests the risky operation procedure on a virtual copy of you. If it works, then the operation can be performed on you. This way, the doctor is limiting the risk of something bad happening during the surgery. And this is not science fiction. It comes actually from the real things that happen in April 1970 when Apollo 13 mission had a problem. It was Saturday, 11th of April, when Apollo mission was going to the moon. Few days later, the space mission changed to bringing the astronauts back.
Okay, we've had a problem here.
There was a huge problem with oxygen tanks that blown out. But on the Earth, they had the simulators that were used to train the astronauts, and they used them to perform certain procedures that can be repeated then in space and repair the spacecraft and bring the astronauts down to Earth. So the digital twin has got 3 layers. One layer is the model that simulates the real object. The other one is like a data house that provides constant feed of data. And the third one is the simulation. So you can actually do something with the model that you have. So you can pretend that there are certain conditions that impact the behavior of the system and see what are the outcomes of that. So industry uses digital twins to predict how machines behave under certain conditions. We can simulate, for example, what would happen if the temperature rises or drops. We can simulate what conditions are optimal for the factory to operate. It's become more complicated when we start thinking about digital twins in medicine and healthcare. But there are some examples. One part of the story is that we can simulate, for example, how the department is doing. This is actually true for the private hospital in Dublin who simulated radiology department, where there's lots of people coming and going, lots of equipment. And rather than testing different setups, you can have a 3D model of the whole unit and predict what would happen if you change certain setup in the hospital. How would that impact the time the patients need to wait for the visit, or how useful the change would be to use the machines a little bit more effectively. So very often when we think about humans, we think about that we are represented by our biology. We are bags of cells. But if you start seeing humans through math and physics, this offers you great opportunity to look inside our body and understand it better. So let's take an example from this book that I started reading a while ago. The best chapter that I recommend is connected, of course, to heart. Usually this organ is associated with emotions and romanticized. But if you look through the perspective of mathematician or physicist, you start seeing pipes and blood pressures and blood flows. And if you can calculate it in a way that allows you to create a representation or a model of the organ, you can easily put it on a computer and start simulating certain conditions, or start predicting what would happen if you were going through certain operation procedure, or if you were given a certain drug, how your cardiovascular system, so the system that transports blood in your body, how it would react. So we are approaching time when we can test things not on humans and not on animals, but on in silico models. More about real digital twin applications you can hear here when Karolina was talking to me about her scientific work. Of course, we can see clearly the benefits of having virtual copies of individuals that allow medicine to be personalized. But also there are challenges connected to data access, data security. So we need to know how to test these models, and we need to know how to regulate them so they actually are applied into decision-making process. So not only technology is developing and our understanding of how we can simulate certain organs and processes, but also the ecosystem is building around the idea. Two prominent institutions that should be mentioned here are VPH Institute, so Virtual Physiological Human Twin Institute, the initiative that is not for profit and started by European Union. This initiative has got very audacious ambition to build a full human digital twin. But also Avicenna Alliance, this initiative gathers business and academia to push the idea further and build a roadmap of what needs to happen, the steps that need to happen to build digital twin that benefits society.